It's a pillar of medical ethics. It's the right of every patient to informed consent, meaning pros, cons, risk-benefit analysis that needs to be individualized, and you need to have that information presented to you. And so, of course, if you buy any prescription med, there's your little pill bottle, and then there's this white, thick, origami-looking thing that folds out, and it's got all these pages, and it's all the legal fine print, right? And that's part of your informed consent. Ideally, the pharmacist and the doctor have said something to you verbally, but that's their risk mitigation move that all the legal people take, is at least you had the fine print in the handout, and you should have read it, ma'am. Okay. Well, here's what's interesting. And again, I've never seen this in medicine. I was shocked when the patient told me. He's like, yeah, I asked for the little white handout that I have for all my other pills when I went to the pharmacy, and the guy stonewalled the stuff, and then he just gave it to me, and it was blank. It was a big white blank piece of paper. I said, no way, that's against the law. It's against the law. They can't just hand you a blank white. He's like, yeah, it's blank. He goes, I'll send you a picture. He took pictures, sent it to me on a cell phone. I could not believe it. Renata Moon, who I think you mentioned, you saw, she was famous for going to a congressional inquiry and holding up the blank so-called informed consent risk benefits that they actually don't even give out. They just have it in the back of the pharmacy, because why would you give something blank? It just puts egg on everyone's face and makes an awkward discussion. And I was like, I can't, no, this isn't real. What? This is impossible, right? So then when I look at it and I dig in, like, how do they get away with this? If you go on the website, you look around, they say some things like, well, because of the rapidly changing, information and stuff, we want to just keep the most up-to-date thing here on the website. So we just direct people to just come here online and read about it. And then if you try to actually go to Moderna or these places and read, it's buried way back on the website somewhere. And I was like, isn't that just convenient? Because grandma is really going to go to your website and dig around all these places to finally get to this thing that she should have just been handed to you. She probably wouldn't have even read that way, but at least she had the obvious, easy route to do that. So they're kind of, hiding behind this fake posturing of it's more up to date when we're hiding it somewhere online that way.